Hi, this is Dr. Trudy Hall. I am here at Region 2 National Medical Association Conference. This is day 2 on Saturday. We're in the city of Baltimore at the Sonesta Hotel. We just came out of a very vibrant morning session about diversity, equity, inclusion, and we ended the session with the Honorable Marc Morial from the National Urban League. So I wanted to say hello and just, Mark, give us a little bit of a highlight of some of the things you talked about in your lecture that just
Well,
occurred.
Dr. Hall, first of all, let me thank you and the National Medical Association for giving me a chance to spend some time. We had a lively discussion,
Yes, we did.
a powerful discussion, and what I sought to really engage with all of the physicians around is their role as community leaders, their voice in community to impact community through civic organizations and churches, through their patient base and the like. Physicians historically, particularly in the Black community,
Hmm.
have always occupied positions of adoration
Hmm.
and respect,
Hmm.
and standing, if you will.
Hmm.
And because of that, I think today's physicians have great influence if they understand their potential
Hmm.
and they use that potential to impact public policy, to impact discussions about healthcare policy, to advance the cause of equal economic opportunity, which is really what diversity, equity, and inclusion are.
Yeah, absolutely. I have a saying, without your health, you have nothing. And that is so important. So, it's kind of interesting. The trend really over the last 20 to 30 years is that minority or African American physician who had their private shingle, who was in the community, that now we've gone through a metamorphosis of a change that now these physicians are now employed by the majority. And how does that how do they still have their voice in
Well,
being
their
in that
voice
environment?
is important because within those institutions,
Mm-hmm.
within the institutions that they work, there's a need for that voice. And I encourage physicians to engage the leadership,
Mm-hmm.
to engage, let's call it the non-medical leadership
Right.
of those institutions around a range of issues. How care is provided, whether the institution is really focusing on the social determinants of health, and the need to recruit and encourage more Black physicians in
Mm-hmm.
to the institution, engage with, the leadership of the institution, and to do it collectively.
Right.
Uh, Black physicians in many instances have allies.
Yes.
It's crucial to not sit understanding and knowing that things could be better or that this environment is not optimal and do nothing and say it.
Yes. Oh, I agree with you 100%. I'm just thinking about my career and the places that I've been and have been the only. And, what's my responsible being the owner. You said something else in your talk about choosing your words, and, everyone has a level of fear. Touch on that a little bit, because I thought that was just so powerful.
So, as we talk about, I'll call it fairness and justice,
Mm-hmm.
racial justice and fairness and diversity, equity, and inclusion, which is, yes, about participation and equal treatment for Black physicians in an institution, but it's also about how care is delivered,
Mm.
how patients are discussed and managed and handled. This is much broader than hiring, although hiring and promoting is at the key. I said we, in these sorts of discussions, cannot be ruled by anger,
Mm.
even if anger is a fuel.
Right.
We have to be thoughtful. We have to be uh, strategic and deliberate about how we talk about these issues.
Right.
We have to understand that what we're talking about is in the broader best interest.
Mm-hmm.
In a changing nation,
Mm.
changing communities, changing demographics in the workforce, what we are talking about is not an option.
Mm.
It's an essential component
Right.
of how any institution is going to operate. And I predict without fear of contradiction, those institutions that embrace diversity as an operating principle and as a philosophy will survive, thrive, and be profitable.
Wow.
Those that resist it are going to ossify
Mm.
and in many instances disappear.
Wow. Wow. So it's
It's
almost a
like,
game. It's almost a game of like a survival.
yeah, it's a game, but it's also
All right.
part of innovation. Think of
Yes.
what institution today could survive without technology.
Mm.
Do you realize 20 years ago,
Mm-hmm.
people said, we don't need these computers.
Mm-hmm.
This filing system is great.
Mm-hmm.
And push back on the technological transformation. Now it's understood as being essential,
Absolute.
as an innovation. There's a part of diversity, equity, and inclusion, which is an innovation designed to make companies and designed to make institutions more competitive.
But also the economic piece of this, because chronic disease costs. It costs when you look at, minorities that are people of color, brown and black, that are having to have dialysis. I mean, dialysis, I think I've got what it is almost like over $50,000 a year just to maintain a patient on dialysis. Maintaining a person who's had a heart attack, maintaining a patient who's had a stroke, and now they're disabled and they can't contribute to the community, maintaining the care for them. So there's a huge economic factor, because it
We
costs the government
have
to
to
pay for these
radically
patients.
shift
Mm-hmm.
how we provide care in this country
Mm-hmm.
to more front end prevention
Yes.
and awareness to try to reduce back end interventions. It's
Yes.
so fundamental. And for Black people who live in substandard housing,
Mm-hmm.
places where there's broken infrastructure,
Mm-hmm.
who have to do, uh, in some instances, deal with a large range of other issues. So, for example, uh, for a person who to get to the physician,
Yes.
it requires a 2 hour bus ride,
Mm-hmm.
and it conflicts and in the navigation with my children and my work responsibilities, and maybe I miss. So, is she missing because she's irresponsible?
Mm-hmm.
Is he not going because he decided to go watch basketball? No, the difficulty of balancing and navigating sometimes these things have to be taken into account. So I think element telemedicine can be an addition.
Mm-hmm.
I think community health workers
Yes, absolutely.
and non-medical providers. We learned at the National Urban League, we had hundreds of community health workers
Mm-hmm.
during COVID.
Yes.
And I told the people who funded it, partially the government, it is a tragedy if you let this community health worker system that we put together for 3 years just disappear because of lack of funding. And I fear that in the post-COVID world where lessons about disparities
Mm-hmm.
are quickly learned, that somehow we're going back to the old normal.
Oh,
We've
absolutely.
gone back to the old
Yeah,
normal,
yeah,
not
yeah,
creating a new
yeah,
normal.
yeah,
We've
yeah.
lost our will in many instances, and they're outliers, meaning institutions
Mm-hmm.
who've decided. I know of an institution, a medical institution in the middle of the country who
Mm-hmm.
have really embraced social determinants.
Mm-hmm.
They capture a whole lot of data
Yes.
on at intake related to social determinants so that they can track how social determinants are impacting some of the things you talked about, some of the acute needs, some of the chronic
Right.
health issues that we have to. And I also think in Black America, we have to create a greater sense. So this is not going to solve the problem. A greater awareness of healthy lifestyles.
Oh,
Like,
absolutely.
and not
Yeah,
being afraid.
yeah,
I'm not trying to
yeah.
shame you.
Yeah,
I'm trying to shame you.
yeah, yeah.
I'm trying to educate you. My grandmother and grandfather walked to church, walked to work, walked because they didn't have a car.
Wow.
Okay. They have a
Yeah.
car.
Yeah.
They just have to walk.
Yeah. Yeah.
So
Yeah.
they maintain a level of,
Yeah. Yeah.
I guess fitness,
Yeah. By
right?
necessity.
By
By
necessity.
necessity.
My
By
grandmother had to
necessity.
carry
Right.
the grocery bag,
Yeah. Yeah.
back to her house.
Yeah. Yeah.
It wasn't in the back of a car, right? Not that we should say, let's go back to living like our grandfathers lived, but we also have to promote healthy lifestyles
Yeah.
and meet, the challenges with health in the middle and realize that prevention,
Mm-hmm.
which is broad, it's about medical interventions,
Right.
it's about early detections. It's about regular checkups. It's about awareness. It's about fitness. It's about diet. It's about a range of things, right?
So a lot of it's about choices. And my mother had an old Jamaican saying, prevention beats cure. And that's like one of my favorite sayings that I always have said in multiple venues. And I think you hit on something. The lessons that were learned during that period of crisis of what were some of the essential needs to bridge some of this healthcare gap, like the community health workers. They're the bridge. They're that bridge that comes into your home
Mhm.
and works with people at where they are, where they are financially, where they are socially, where they are, economically. They just meet them to where they are. So, as policies and payment structures are being developed, what is the voice of the African American physician to make sure that they continue to advocate for all of this? The biggest cost of healthcare is not in the hospital, it is outside the hospital.
And I may have not emphasized this enough. The
Mm-hmm.
voice of African American physicians is also operationalized through the NMA.
Yes. Thank you.
So, in many respects, it's not just about individual voices,
Mm-hmm. Yeah.
it's about collective voice. Think of how the AMA operates.
Oh, yeah.
Think of how a big time organized healthcare operates. They
Mm-hmm.
operate through their trade associations, through their
Mm-hmm.
professional associations, through their institutions. We have to become better at that,
Right.
you know, and realize that the NMA can and should be a bully pulpit, can and should
Absolutely.
be a public policy intervener, can and should provide a voice.
So what I want to end with is for those who don't know, so you have that broad NMA structure, which is national. We have our regions, like Region 2 are the 6 states really of a mecca of education as well as healthcare innovation, being, Pennsylvania, Delaware, Maryland, DC, Virginia, West Virginia. That is Region 2. So part of this message is as we have things nationally, we are working with NMA to kind of get some of those initiatives locally through our regions and our state and local
That's
chapters, because
smart.
that's the way you have to go to be
Well,
able
it's
to move
smart
the
because
needle.
you're close,
Mm-hmm.
not way out there, but right
Mm-hmm.
here close to Baltimore and Philadelphia
Yeah.
and New York and all of the power centers,
Yeah, it is.
political power
Yeah.
centers,
Yeah.
economic power centers, and let's face it, a lot of the healthcare power centers
Mm-hmm.
are here in the Mid-Atlantic region on the East Coast from Boston to Washington.
Absolutely, absolutely. So we're going to end our very amazing talk, but what are the really top things you want to kind of leave with us as we kind of close our session?
I want to continue to lift up the D3
Mm-hmm.
message and call to action, which is the National Urban League's campaign for this year. D3,
Mm-hmm.
defend democracy,
Mm-hmm.
demand diversity, and defeat poverty.
Absolutely.
This is what this fall's election, from our community standpoint, is all about. We must reclaim our vote. We must ensure that we're using our voice.
Absolutely. Well, Mr. Morel, thank you so much.
Hey,
And
thank
thank
you
you so
very
much for
much.
being here at
Keep up
Region
the good
2.
work. Thank
Thank
you.
you.
My pleasure.